What is eosinophilic esophagitis? Eosinophilic esophagitis, or EOE, is a condition that affects your esophagus. The esophagus is the tube that carries food from your mouth to your stomach. In EOE, certain white blood cells, called eosinophils, build up in the esophagus. This buildup can cause inflammation and make it hard to swallow. EOE is a chronic condition. This means it lasts for a long time. But with the right treatment, you can manage your symptoms and live a normal life. EOE can affect anyone at any age. However, it is more common in males and often starts in childhood or early adulthood. If you think you or a loved one might have EOE, it's important to talk to your doctor. Why does EOE happen, and what does it feel like? Doctors and scientists are still trying to understand exactly what causes EOE. However, they believe a combination of things is involved. These include genetics, allergies, and the environment. Many people with EOE have other allergic conditions too, such as asthma, eczema, or hay fever. EOE can cause a variety of symptoms. The most common is difficulty swallowing, also known as dysphagia. This might feel like food is getting stuck in your throat. Other symptoms include heartburn, chest pain, nausea, and vomiting, and weight loss. If you have any of these symptoms, it's important to see your doctor to get a diagnosis. Figuring out if you have EOE. Diagnosing EOE requires a few steps. Your doctor will start by asking you about your symptoms and medical history. They will also perform a physical exam. To confirm the diagnosis, your doctor will need to perform a procedure called an esophagogastroduodenoscopy, or EGD. During an EGD, a thin, flexible tube with a camera on the end is inserted into your mouth and down your esophagus. This allows the doctor to visualize the lining of your esophagus and take small tissue samples called biopsies. The biopsies are then examined under a microscope for signs of inflammation and eosinophils. It's important to note that finding eosinophils in the esophagus doesn't always mean you have EOE. Other conditions can also cause this. Your doctor will consider all of your symptoms and test results to make an accurate diagnosis. Beginning treatment for EOE. Once EOE is diagnosed, your doctor will work with you to develop a treatment plan. The goal of treatment is to reduce inflammation in your esophagus, control your symptoms, and prevent long-term damage. The most common initial treatment for EOE is a type of medicine called a proton pump inhibitor, or PPI. PPIs reduce the amount of acid your stomach makes. You will likely need to take a PPI twice a day. Your doctor may also recommend dietary changes, such as avoiding certain foods that can trigger EOE symptoms. These foods can vary from person to person, but common triggers include nuts and seeds, wheat, dairy products, shellfish, soy, and eggs. Your doctor may recommend keeping a food diary to track what you eat and your symptoms. This can help identify your individual triggers.